I rise to speak to this third reading of the New Zealand Public Health and Disability Amendment Bill on behalf of the ACT Party. We will be supporting this bill, as I think every party in the House is, and I'd like to congratulate the Minister on this bill. I think it makes some very pertinent changes to the public health sector. The initiatives in the bill have been pretty well traversed by many of the speakers that have preceded me, and I'll just mention a few. The establishment of the Health Quality and Safety Commission is a very good move, and I think that we can expect to see some good things come out of that. It allows elected district health board members to be appointed to other DHBs. This too is something that makes a good deal of sense, and we've already seen that there are some people that have been appointed to more than one district health board because they have the right skills and ability and experience in the health sector to make meaningful decisions and in many respects lead the discussions that need to be had. It amends the district health board planning requirements to provide for planning and accountability framework that takes into account national, regional and local requirements, and the speaker that preceded me, the Green member, mentioned that there are things that are very pertinent to happening at a local level, but there are times, of course, when regional and national initiatives are needed, usually because of geography or because of the sheer size of the issues being looked at. The bill also increases ministerial powers to direct district health boards to enhance the use of shared services in the health system. And for many years now, we have been seeing boards cooperating and collaborating to establish shared services, and the result of that is just about always greater efficiency and much better utilisation of scarce resource, particularly financial resource. And so we want to see much more of that. I think as time's gone on, we are seeing, as I say, much better cooperation and collaboration between district health boards, and particularly since the change of government, we've seen a significant emphasis on the regionalisation of services where this is appropriate, and this too has brought greater efficiency to the sector. As a result of that, we are seeing patients being seen in a much more timely manner, and waiting lists in many areas have been reduced, and that's exactly what we need to see. I do think that there's a lot of scope yet. This has started much better cooperation between the public and the private sectors. The private sector is able to gear up when it has certainty of contracting to be able to provide services, particularly where there are significant gaps or long waiting lists or whatever in the public system. And we shouldn't get caught up in the debate, Mr. Speaker, or the philosophical blinkering of the ills of the private sector or the ills of the public sector. We should be striving day in, day out to break down those barriers so that we actually consider healthcare, health services, the health workforce as an umbrella. It doesn't really matter if you're a patient who is ill, where your services come from, as long as you are able to receive timely, quality services. That should be the aim. The health sector workforce was also mentioned by the Green Party member, and I, if he hadn't mentioned that, was going to launch into that. We have seen in the last week a report saying that shortages of health professionals in the short and the long term are significant issues. And one of the things that I talked about a lot when I was health spokesman for the ACT Party in opposition was the fact that we are very good at training health professionals, right through from physiotherapists and occupational therapists to nurses and doctors, very good at training them, but we're not good at keeping them in New Zealand. And I used to talk about training our health professionals for export. Sadly, there is far too much of that happening, and we need to find ways to combat this phenomenon. Retention and recruitment and retention are significant issues still for the health sector, and they're going to be increasingly so looking into the future. Ian Lees-Galloway, when he spoke, talked about Australia. There are some impressive things happening in Australia. He talked particularly about primary care, and I think there are some lessons to learn there. He talked about the focus on obesity, tobacco and alcohol. What he didn't say was tell the House about the other side of that equation, and that is that the Australians also have much greater involvement of the private health sector in the overall health picture. More Australians belong to health insurance schemes. The government also makes a significant effort to contract with the private sector, and those things certainly make a significant difference to waiting lists, to waiting times, whichever you want to use as your measure, but much better at getting medical services matched with patients in a timely manner and quality services. That also means that we have to pay particular attention to our economy, and this government is making significant gains in this area. I think we could be making faster significant gains if we were prepared to make some tougher decisions, particularly about tackling government spending, but that really is a matter for another day. One of the things that we see with this particular bill, and I am in favour of it, the initiatives are very good, but I do wonder if they are just about tinkering with the public health sector that we have rather than looking to make significant change, significant and meaningful change. And one of the things that I think has been a lost opportunity with this bill is the grappling with the way that we elect and run the actual boards themselves, the district health boards. We've just had local government and district health board elections, Mr. Speaker, and one of the questions that I would like the Minister to address is why do we have these DHB elections? Most people have absolutely no idea who the people are that they're expected to vote for. There is a cost to the elections. I asked the Minister in the House the other day what the cost of running the elections, of selecting people for district health boards was, and what the cost of actually running the boards themselves was. And I think that we need to look at the sense in doing this. Do we have to have 11-person boards when in fact a 3 or a 5-person committee might in fact do just as good a job? Would it do it more efficiently? What would the saving to the taxpayer be, and how much would that translate into health services were that money to be redirected there? And I think that's something we do need to look at very seriously. What is gained by having elections? What is the percentage of people that actually voted? The figures aren't in yet from the latest round of DHB elections, but we need to look firstly at the percentage of people who vote. Do these people actually indeed know the people that they're voting for, know anything about them? Are we electing the right people? Or are the district health boards heavily reliant on the ministers' 4 appointees to each board to actually get the skills that they need? I think that personally we'd be much better off with a 3 or a 5-person committee that is appointed by the Minister to run each of the district health boards, and there would be significant savings there. I'll finish there, Mr. Speaker. I would like to reiterate that the ACT Party does support this bill. We think these are good initiatives, that they make a good deal of sense, particularly the way around the running and the functions and the organisations of the district health boards, but it is an opportunity lost. It would have been an opportunity to look if things couldn't have been run much more efficiently. And I actually take the points that the Labour Party and the Green Party members have made about looking to the future in terms of our health services. We do need to take seriously the workforce issues and the use of the public sector, particularly in promoting primary care. Those are issues that, as our population continues to age, we need to take seriously, and I look forward to continued debates on those issues. Thank you.